Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today, a Triad production. I'm your host, Sharlee Dixon. My guest today is Dr. Jessica Schleider. Jessica is Associate Professor of Medical Social Sciences at Northwestern University, where she directs the Lab for Scalable Mental Health. Schleider completed her PhD in clinical psychology at Harvard University, her doctoral internship in clinical and community psychology at Yale School of Medicine, and her BA in psychology at Swarthmore College. Her research on brief scalable interventions for youth depression and anxiety has been recognized via numerous awards, including a National Institutes of Health Directors Early Independence Award, the Association for Behavioral and Cognitive Therapies, ABCT, President's New Researcher Award, and Forbes 30 Under 30 in Healthcare. Recently published, Jessica shares her research on single-session interventions in her new book, Little Treatments, Big Effects: How to Build Meaningful Moments That Can Transform Your Mental Health. We're excited to have Jessica back with us today to discuss Project Yes and supporting adolescent mental health. For more background information about Jessica's work, check out her previous episode where we discuss her Lab for Scalable Mental Health and single-session interventions. Welcome back to the show, Jessica.
Thanks so much. Happy to be here.
Awesome. Thank you so much for joining us. Can you provide an overview of what Project Yes is? What is its mission? And does Yes stand for something?
Yes does stand for something. Project Yes stands for Youth Empowerment and Support. And the goal of Project Yes is to take the findings from our research on single session digital interventions for youth mental health and make them available as a public resource that anybody can access. And the objective of Project Yes is really to offer 4 different single session digital mental health programs that we've tested and randomized clinical trials over the years in thousands of teenagers, and make sure that anybody from anywhere, any location, at any time can try them out. And right now, many thousands of teens, I'm happy to report, have used Project Yes from all over the world at this point. And we're continuing to see really promising outcomes of the interventions for folks who reach it.
That is awesome to hear. And we'll get into later about technology and how that's integrated. But it must be because you're reaching children and adolescents all over the world. But can you tell me what has inspired the creation of Project Yes?
Sure. So something that I'm frustrated with as a scientist, as a clinical psychologist, is that a lot of treatment research and the results of treatment research, evidence-based interventions, never leave the clinical trials that they're first tested in. They're never made available publicly for people to actually benefit from. It just ends with a scientific paper. And that is incredibly frustrating. And that all kind of came to a head for me in around 2019, so pre-pandemic actually, when a couple of news agencies, The Atlantic and Vox, wrote about my lab's research on single session interventions. When those articles were published, I started to get just floods of emails and calls from parents all across the US asking, hey, where can I buy your single session interventions? And it was very interesting to me for 2 reasons. One, I wanted everything to be free. So there was no place where they could buy it. And 2, at that time, there was actually no way for anyone to access our interventions unless they took part in a research study in my lab.
Oh, wow.
And that didn't sit right with me. As our lab's mission is to scale up access to mental health support. I wanted to create a way for people to try out our interventions, even if they did not want to take part in research. And that led my lab to create Project Yes as a website. Because this is sort of an atypical thing to do, making interventions publicly available, we had to route this project through our university's institutional review board. So get it ethically reviewed. And the university characterized it as not human subjects research because all we were doing was making resources available. And what that designation allowed us to do was literally to just let anybody try out the interventions and to collect optional data that people could give to us if they wanted to, but they could choose to skip those, surveys on how they liked it and whether the interventions worked. So for the past now 5 years, Project Yes interventions have been publicly available for anybody to use and anonymously. So we get no identifying information, no IP addresses from anybody who uses the programs. And many people among those who have used it have chosen to tell us how they liked it and give us feedback. So it's been a really exciting opportunity for us to gather data on how to make our interventions better, while also being consistent with our lab's mission, which is to democratize access to mental health support.
Nice. I love that it is free and access to it is for everyone across the board. Because, like you mentioned, that's not something I know personally as a clinician, that's not something that I've ever really seen. Maybe
Mhm.
you get a snippet of something, but to have full scale programs that are available for free is amazing. So, thank you for that. So, how does Project Yes support adolescents other than, the things that we've mentioned, specifically with
Sure.
anxiety and depression?
So the four single session interventions that are publicly available within Project Yes, are each essentially a bite-sized component of skills taught in longer term evidence-based treatments like cognitive behavioral therapy, mindfulness-based therapy, or therapies tailored to specific subpopulations like sexual and gender minority young people. And so each intervention teaches a skill that, as a standalone component, has shown promise to improve depression and anxiety symptoms in youth. So, one of the SSIs called the ABC Project, which stands for Action Brings Change, the ABC Project teaches behavioral activation, the idea that what you do can shape how you feel. And so you aren't stuck being or feeling depressed, right? There are literal steps that anyone can take at any time, regardless of your starting point, to help somebody get out of feeling that stuck place that you can often feel when you're experiencing depression. And the intervention includes a personalized action planning component. So people end the program with a step by step plan for how they can connect with people who they care about, do something just for themselves, and make a step towards a goal that they care about. So there are outputs, action plans that come from each of these interventions. Another one of the interventions in Project Yes teaches self compassion. People experiencing anxiety and depression, and particularly youth, can be incredibly hard on themselves. And a really common pattern with that self criticism is thinking that, well, I need to be really critical of myself, or I won't do well enough in school, or I won't do a good job on what I'm
Mhm.
trying to reach. I need to be hard on myself. I need to feel anxious because that's what guarantees that I'm going to succeed. And this intervention called Project Care teaches people how and why actually being kind to yourself is a much better strategy for reaching your goals than being super critical of yourself. And it gives some scientific evidence for that and some skills to use for people to take action on that idea. What all of the interventions have in common is they all include personal stories and narratives from teenagers who've worked with us to develop each of the interventions. They all include scientific information about the brain and how that works, and how neuroscience can help us understand why skills like behavioral activation or self compassion can be helpful. They all include opportunities for teens to give their own advice anonymously to others for using the skill in everyday life. And they are all meant to be sources of empowerment. So, all of the interventions are framed as opportunities for teens not just to learn about a skill that could be helpful to them for coping, but also to help others who are experiencing similar things, because their perspective and their own lived experiences are incredibly valuable to their peers. So at the end of each intervention in Project Yes, no matter which one they choose, teens are invited to share their best coping advice based on what they learned in the intervention and also their own experience. And if they give us permission, we then post their advice anonymously after reviewing it in our Project Yes Advice Center. And
Okay.
the Advice Center now contains hundreds of pieces of advice from teens who've given us permission to share them from all over the world.
Mhm.
And anybody from anywhere can scroll through that advice center to feel a little bit uplifted or less alone about what they're going through. So, Project Yes really does both give teens skills to cope more effectively with depression and anxiety, and also gives them a chance to heal through helping which is a very scientifically based reality that actually helping others does have that curative effect for folks. So those are the ways in which the interventions are designed to help.
Nice. I love that students are able to use their own positive things or things that they've learned to be able to help others. Teens tend to get a lot of negative feedback from each other. So to be able to use something positive is amazing to me. We do discuss a lot about how this works with adolescents. Has it, or have you done any research to see if these work with maybe parents or people that are older than adolescent age?
Yes. So another one of our freely available single session interventions online is specifically for parents. This is called Project Empower. It's also free, also not a research study. Anybody can use Project Empower if they want to. But this is a single session self guided activity designed for parents of kids who are experiencing or at risk for anxiety. And the intervention gives these parents strategies for promoting brave behavior in their kids, even when it's hard and even when it's extremely distressing as a parent to watch your kid go through that struggle of approaching things that are very scary and overwhelming. And what this intervention does is it teaches parents about what parental accommodation of anxiety is and how it can start a cycle that's unhelpful to their kids. By accommodation, I mean things that parents do to prevent their kid from having to experience anxiety in the first place.
Ooh.
So, allowing them to stay home from school if they're worried about a test, or if they're nervous about what their peers are going to think of something that they say or did. Accommodating kids and allowing them to avoid those anxiety provoking situations makes their panic go down very quickly. So many
Mhm.
parents totally make sense. Just go that route of saying, you know what, we can have a mental health day at home and we can just stay
Yeah.
here and we can just not bother with all of it. That works in the short term, but in the long term, it actually takes opportunities away from kiddo to learn that they can manage difficult situations and to learn how to cope in the real world, regardless of the difficulty, and gain that self confidence, right? And so Project Empower helps parents to take steps towards promoting brave behavior and reducing their accommodation of their kids so that they can help their kids grow their coping skills and muscles in the real world.
Nice. Nice. That is really cool. Was just curious. I had no idea that there were things that were specific to parents because as a clinician inside of a school system, I hear a lot of parents being like, I just gave them a mental health day. Today just wasn't the
Yep.
day. But now they don't really want to come back to school. And so that creates
Exactly.
a whole nother
Yeah, now
level
that's
of
their coping
problem.
strategy is
Mhm.
just
Right.
avoiding,
Right.
which isn't
Avoidance.
helpful.
Absolutely.
Yeah.
It's not at all. Not at all. So thank you for that. I will definitely be sharing Project Empower with my parents. Thank you for that resource.
Yeah.
So, speaking of that, are there challenges and barriers that Project Yes has encountered, and how can clinicians address them?
Absolutely. So it's interesting. I'm very interested in scaling up mental health supports and democratizing access. And so at first I was really excited to make all these resources free and really optimistic about folks being able to access them. But as it turns out, making things free is not a standalone effective implementation strategy. You have to be a lot more intentional than just putting stuff out there, right?
Yeah.
If you
Mhm.
build it, they won't necessarily come. You have to be thoughtful about integrating it into systems so that people know about it
Mhm.
and can access it at points of need. So, in the past several years, we've pursued many initiatives to partner with communities, school settings, and clinics to figure out how can we embed Project Yes so that it's offered to people at opportune moments when they're looking for care but can't necessarily access anything. A big one is using Project Yes to offer to people on waiting lists for treatment. That waiting period can be really damaging because it's just a period of sitting around and not getting help and not knowing what to do with your symptoms, but that can be weeks, if not months in some cases. So, in several ongoing studies, we're testing Project Yes as a resource to folks who are facing those long waits to try to reduce some of that deterioration that happens during that waiting time. And that's something that any clinician could put into practice if they have a waiting
Right.
list, which is a pretty ubiquitous problem in mental health
Mhm.
care. Another opportunity is within primary care settings. In many different clinics, pediatric anxiety and depression screening at well visits is the norm. But typically, when kiddos screen positive for significant anxiety or depression in the context of a primary care well visit, what their family gets is a list of referrals to providers who have really long wait lists or who
Mm-hmm.
don't take their insurance.
Mm-hmm.
So we've experimented in our work with offering Project Yes directly to families at the point of elevated screening so that they're offered something they can use for free, flexibly whenever they want to, that's evidence-based, and that they don't have to wait for, and that they don't have to struggle to find. Another option is offering it as a resource to schools, literally putting up QR codes in the hallways so that teens can use their phones to try out the interventions at any point in time. And that strategy has been especially successful for us because it allows teens to self-refer into the interventions,
Yep.
which is completely different than how mental
Mm-hmm.
health care tends to work for
Yep.
students in schools. Typically, it's a very top-down, adult-driven process
Mm-hmm.
where they're identified as needing help. Somebody sends them to the counselor, and whether they want it or not, they're there.
Yep.
um,
That's how it works. Yeah.
Project Yes, per the empowerment part of youth empowerment and support, our goal is to allow teens to opt in to mental health support when they think there's a need, not when other people think there's a need. And that's a very different model. But in a lot of the research that we've conducted as a lab, interviewing teens on barriers to accessing treatment, the most common barrier that teens report in terms of, when they want treatment but can't access it for their mental health are adults in their lives, parents, caregivers who they don't want to talk to about their mental health difficulties, who they're worried will respond negatively. So Project Yes, by allowing teens to opt in themselves, is circumventing one of the biggest barriers that teens actually perceive to accessing support.
We'll be right back after word from our sponsor.
Most of us spend more time at work than anywhere else doing anything else. So why not spend that time in a job you love? Introducing Triad's Jobs Marketplace, the only job site dedicated specifically to behavioral and mental health professionals. Featuring more than 1,000 open jobs from dozens of behavioral and mental health employers, and searchable by location, professional field, employment type, specialization, and more. Jobs Marketplace helps you find your next career opportunity. Full-time, part-time, or gig time, make the most of your time. To access Jobs Marketplace, register for your free professional account at hellotriad.com/BHT. That's hellotriad.com/BHT, and then click to Jobs Marketplace. If you're already a member of the Triad community, visit app.hellotriad.com/jobs. That's app.hellotriad.com/jobs. Visit us today and take your next career step tomorrow.
Nice, nice. And what you mentioned is exactly how it goes. Every so often we'll have students come in and say, I need help with this or that. But a lot of times it is the parent or even me as the social worker reaching out, like, I've noticed some things, and it
Exactly.
turns into, you're going to do this, or I would really like you to do this. So I
Mhm.
really like the idea of students being empowered to care for themselves. So it's a really
Exactly.
cool idea. I really like that. So, what are some common outcomes or benefits observed by participants of Project Yes? What does success look like?
Sure. So we measure success in lots of different ways across different studies. I will say that you can do the interventions in Project Yes without giving a single data point to us. You don't have to say
Right.
you respond to any questions if you don't want to. You can skip them completely. But the folks who do give us data, who complete Project Yes, and this is again from thousands of people at this point, report significant reductions in their sense of hopelessness from before to after the interventions, improvements or reductions in their sense of self-hate, increases in their sense of perceived control over their emotions and behaviors. And they tend to report that the interventions are helpful, that they would recommend them to a friend, that they would do more of them. And we do have people coming back to do multiple single session interventions if they want. About 10% of folks come back and do another one, which is about what we expect. The most common number of interactions with digital mental health support is one. And in clinical trials, testing the interventions within Project Yes in larger, more formal experiments, we've been able to follow up with people who've tried the interventions across several months. And we find that compared to control conditions, the interventions within Project Yes have reduced depression symptom severity 3 to 9 months later, reduced anxiety symptom severity, also 3 to 9 months later, reduced, this was a surprise to us, restrictive eating across 3 months, which
Hmm.
is really comorbid with
Hmm.
depression symptoms and which has some of the same underlying risk factors like
Mhm.
hopelessness. So that kind of makes
Mhm.
sense, right? And our intervention that's specifically for sexual and gender minority young people, Project Rise, which teaches about minority stress theory and how to cope with a world that's often just not built for fairness to everybody and where discrimination
Mhm.
is often rampant and something that's a reality that folks have to deal with. We see improvements in identity pride for folks who identify as sexual and gender minority, as well as decreases in internalized stigma. So there are different kinds of outcomes depending on which interventions folks resonate with that feel like a good fit for them
Mhm.
that we can see across time.
Okay, nice. We've talked a few times about the integration of technology and how it is Project S is on a digital platform. I myself did check out Project S on your website, and I noticed immediately that you could choose which language your intervention comes in. So that to me is something that I've never really seen before. So on top of it being free and accessible to anybody, your
Right.
website actually allows for people to change it there, and so your interventions are available and I don't know how many languages. So I do wonder how many languages is it available in? And then can we talk more about how Project Yes integrates technology? So you did discuss using a QR code for schools. So what other ways does Project Yes integrate with technology?
Sure. So I can start with the language and our cultural adaptations of Project Yes. You are absolutely right. Most digital mental health tools just have the automatically translate
Mhm.
button in the corner, which is not awesome. And the reason it's not awesome is because it's almost never just a word for word
Right,
translation that
right,
works from one language to another, especially
right.
with terms related to mental health and coping.
Hmm. Hmm.
There are idiosyncratic ways that people describe all of the terms that we talk about in our interventions by language and culture. And we can't assume that the internet is going to automatically understand those nuances. So we've been really fortunate to partner with folks from a variety of different countries and across the US to really go through a careful process of not just translating, but culturally adapting the interventions in Project Yes. By which I mean conducting focus groups with people who are from and speak the language of the population we're hoping to reach with a new adaptation. So we change the examples that we give in the interventions to be more resonant with the population and the culture that we're trying to reach. Certain videos in the interventions in some of our focus groups, for example, with youth in Turkey, they just didn't land the same way. So we asked them, what videos should we include? And what kinds of examples should we give to make this make sense in your context? And so we've, through that work and through our collaborators across the globe at this point, we've been able to create versions of Project Yes that have been adapted to different populations. And that includes youth who speak Spanish. We had a partnership with the City of San Antonio Public Health Department and did a citywide rollout of Project Yes after adapting using a youth advisory board in San Antonio into Spanish. We are in the process of doing Ukrainian and Polish translations with teams there, working with youth to adapt for that population. And
Mhm.
currently, the other languages that Project Yes is available in include Haitian Creole, Arabic, Hebrew, Turkish. I think there are a couple of others, but there are
Right.
plenty in the works. And that's just been through very generous collaborators who've reached out to my lab team in hopes of creating free mental health resources for kids in their community.
That is awesome. And you just said what I meant. Automatic translations don't reach the cultural side. So that is very interesting and really empowering that you're able to change the intervention to fit that specific community of
Mhm.
folks. Not all interventions, whether it's something found online or even a clinician in front of you, are able to actually do that. So it takes
Yeah.
cultural competence to another level.
Well, at least cultural humility. We're doing our
Yeah.
best and very much admitting that we would not know the first thing about translating and adapting for Ukrainian youth,
Mhm.
for example. So we need their
Right.
help to do that.
Right. Nice. So you did mention being able to collaborate with schools, especially by using things that teens are interested in, like maybe a QR code on a wall so that they can just self-refer. What are other ways that Project Yes collaborates maybe with schools, communities, or even other mental health professionals?
Yeah, so this is where the knowledge and wisdom of folks on the ground in these communities is most helpful because the correct or the most effective implementation strategies for a given setting are going to inevitably differ by the context. So in some settings, for example, it really works well to have youth champions of Project Yes and peers who kind of by word of mouth share with their friends that this could be a helpful resource. In other communities, it really helps to have sort of a community leader or specific folks in school, so trusted school staff, to share about Project Yes. In other contexts, it's really helpful for individual therapists who already have a rapport with a kiddo to share about the information. We're still, on the very early end of figuring out what are the best implementation strategies for Project Yes. But right now, we're enjoying doing some of that work and some of the research to figure that problem out. But as it stands, Project Yes is a freely available website that anybody can creatively integrate into what they're already doing as they see fit. And if anyone ends up doing that and has feedback for us on what worked or didn't, I'd love to hear it.
Nice. That was actually going to be one of my next questions. So, how can people or individuals, organizations, how can we get involved with the work of Project Yes? How can we support the work? How can we further its mission?
Yeah. So feel free to use it. I think, the point is for this to be disseminable. And if folks are interested in partnering with our lab to test out different strategies for disseminating, please reach out. The best part of the research that we do as a lab are the partnerships that we have with different community settings, organizations across different sectors. So if there's an interest in approaching this from a more scientific standpoint of like, how do we get this to kids in a way that's effective? I'd love to chat more. But if you just want to use it in your everyday practice or in your setting, go to schleiderlab.org/yes and take a look around. You're welcome to try out the interventions. Again, it's anonymous. We don't track who's using it. So you can absolutely integrate it as you see fit. In terms of ways to support it, sharing it on repositories of resources that you already have for digital mental health supports and offering it to folks who use your patients or folks in your community settings. Those are all good options. But right now, sort of the next frontier for Project Yes is we've applied for some grants and larger funding to upgrade our technology. Right now, Project Yes is, all the interventions are online. They're self-guided programs that anybody can do. But I am not a computer programmer. We don't have any computer programmers on our team. We rely on Qualtrics, which is a survey data collection platform. And we've kind of finagled it into something that can house our interventions. But that's not the most user-friendly interface in the world. So right now, our team, in collaboration with some wonderful nonprofit partners of ours, are seeking funding to find a more user-friendly home for Project Yes, so it's easier for people to try out and access in the future.
Nice, nice. And I mentioned that I went on to the Project Yes website. I actually did it from my phone. So you can use
Yeah.
the site from other places. I was in the car and I'm like, let me just check it out while I ride. And I was able to look through a few of the interventions and I did see a few of the adolescent reviews and things that they talked about. But speaking about testimonies, are there any specific success stories or testimonies back from when you guys were this was just in the research parts that you can share with us?
Oh, sure. I mean, we have a whole folder of quotes and emails that we store from past participants from our studies and research that when we're having a particularly tough research day, we just go back and read all the testimonials from that folder. But we routinely get comments of this saved me in a moment where I didn't have anything else, or
Mhm.
I didn't know where else to go, but I keep coming back to Project Yes when I'm having a rough time. Or I just love scrolling through the advice center and looking at what other people have had to say. So it isn't even the interventions in that case, but we're still thrilled that we're providing a resource that can help folks. And yeah, we save all of that feedback, all of those emails. And there's also a place within the Project Yes survey where people can give us positive or constructive feedback. And we get quite a bit that way too. So it's an uplifting thing to go through the data for sure.
Absolutely. It sounds like it would be. I'm just listening to hearing you say it. It's uplifting for me. That level of empowerment for teens is interesting, and is necessary. And something that you and I have discussed kind of off camera is the impact that the COVID epidemic had on our teens and their levels of mental health. I know being in a school system, I have seen the numbers of anxiety and depression and a lot of social anxiety really since then. Can you speak to how specifically Project Yes works for that? I know it was created way before, but have you seen an uptick in the use since then? Does
Yeah.
it correlate?
Yeah. So that's a great point. The COVID-19 pandemic pretty much turned teenagers' worlds upside down and kids' worlds upside down when it happened. Yes, it was a moment in time when we were on lockdown, and that has since passed. But the impacts of having multiple years of your childhood and adolescence
Mhm.
completely on lockdown,
Yeah.
the social impacts, the emotional impacts of that, they'll ripple for the rest of these kids' lives.
Yeah.
And when that lockdown first happened, the acute effect on access to mental health resources was extreme.
Mhm.
So before the pandemic, there was already a massive gap in kids' access to mental health treatment. But when that happened, kids no longer went to school. And that's the main place where kids actually access mental health resources.
Right.
So all of a sudden, overnight, millions of kids were cut off from the only options they had for
Yep.
mental health care. So when our lab realized that that was happening, we actually ended up applying for funding from the National Institutes of Health to do a nationwide evaluation of two of the interventions in Project Yes. And we were lucky to get that grant. So we did a national clinical trial testing the Project Yes interventions in adolescents with depression from all 50 states in a sample of about 2,500 teenagers. And we were able to get that resource to that many people and also detect effects on depression and anxiety while lockdown was happening from the interventions. So it's structured to be accessible when no other options exist. And
Mm.
that's really one of the goals of the mental health supports that we create. They're designed such that they're not contingent on people having access or having the privilege to know about other kinds of mental health support out there.
Right. Right. Nice. Okay, before we leave today, can you leave a final message to our listeners? What advice would you give to other organizations or initiatives aiming to support adolescent mental health?
So I think the one of the key messages I think is most important for anyone working with teens to understand is that giving them more autonomy and more agency and more choice in their mental health
Mhm.
journeys is not only important, but rare. Teenagers do not get a lot of control. They do not get a lot of say in where they get support, how they get support, or at what times. And whether it's through Project Yes or through some other initiative, finding ways to promote teens exercising that developmentally appropriate drive for being their own person
Mhm.
is therapeutic in itself. That's the basis on which Project Yes was built in the first place. And I think we could do a lot of good by integrating that perspective into other kinds of supports that teens receive.
Absolutely. So, Jessica, where can our listeners learn more about your work with the Lab for Scalable Mental Health, Project Yes, and your book, Little Treatments, Big Effects?
Sure, I'll go in the opposite order of those things. So the book is on Amazon or anywhere books are sold. Little Treatments, Big Effects is the title. It's easy to find. If you're interested in this single session approach to mental health support, including Project Yes, but not limited to it, then that may be a good resource. If folks want to get in touch with me, they can find me. I'm an associate professor at Northwestern University, so you can find me on the university's website. I'll list it in the faculty directory or at my lab website, schleiderlab.org. That's where a lot of the information about Project Yes lives, our research, and open resources for folks, whether they're kids, parents, or therapists.
Nice. Thank you so much. I really appreciate you spending some time with us today, Jessica, really coming back and spending time. I really enjoyed our conversation. Thank you again.
My pleasure. Thank you.
And I also want to thank our listeners for dropping by and joining Jessica and I. It's always great to have you with us. Before we go, I would like to invite you to join us for the June 2024 Wellness Summit Series on June 29th. This online event will feature 3 heart-centered hypnotherapy experts who will share their insights on building conscious leadership skills and techniques for personal growth and trauma recovery. This is online and free to attend. You can learn more at triadhq.com/WSS. Connect with BHT Podcast and other mental health professionals on the Triad community, the LinkedIn for mental and behavioral health. Create your profile for free at hellotriad.com. And lastly, the resources for this show and all of our other episodes can be found on our website at triadhq.com/BHT. Thanks again for being with us on the show, and we'll look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.